In today's Health Watch, the CEO of a company behind the popular diabetes and weight loss drugs Ozempic and Wegovy will face questions from U.S. senators today. That's because research shows that Americans are paying far more for those drugs than people in many other countries. For example, Wegovy costs about $1,300 a month here in these United States versus just over $90 in the UK. Our senior consumer investigative correspondent, Anna Werner, has been digging into these high prices and asking questions. She joins us now. Anna, good morning.
Good morning, Tony. And that's the question. Why does a company price a drug at under $100 in a country like France and 10 times as much here? Senator Bernie Sanders, who will be leading that hearing today, says he has a simple answer: greed.
You got to end this incredible greed, which is taking place literally on the lives of people.
Vermont Senator Bernie Sanders says drug companies are legally allowed to set their prices as high as they want in the U.S. And the prices Novo Nordisk has set for Ozempic and Wegovy here are, in his words, ripping off patients. A Senate committee report in May found the company charges Americans with type 2 diabetes $969 a month for Ozempic, while prices are set at $155 in Canada, $71 in France, and $59 in Germany. The list price for its weight loss drug Wegovy is $1,349 a month in the U.S., but the same product is just $137 in Germany and $92 in the U.K. The senator says he's been pressuring Novo Nordisk for months.
You have these conversations with them. Are you saying, look, I'd like you to lower the drug price by 50% or 40% or 20%?
I'd like them to not charge us any more than they are charging, on average, people in other countries.
And their response to that is?
It's complicated. You have a very complicated healthcare system in America. We're working on it.
The company told us that 99% of commercial health care plans in the U.S. cover Ozempic and about half the plans cover Wegovy, and that 80% of U.S. patients with insurance pay $25 or less per month for the prescriptions. But some employers have stopped covering the drug because of the high cost combined with high demand. In April, North Carolina stopped covering weight loss drugs, including Wegovy, for state employees like Traylene Williams.
Once they terminated the coverage, it was just like a train hit me.
Williams works in IT for a state agency. Morbidly obese in 2009, she had bariatric surgery, but later found her weight creeping back up. So in 2021, she started Wegovy, paid for by the state's health insurance plan. Now, with coverage dropped, she can't afford the over $1,300 a month price tag.
That's like a mortgage payment that I simply cannot afford.
A Yale study published in JAMA earlier this year found the drugs could likely be manufactured for prices far below current prices. How much? One of its authors told Senator Sanders at a meeting last week.
Semaglutide's the generic name, can be possibly manufactured for just under $5 per month.
University of Minnesota professor Stephen Schondelmeyer studies pharmaceutical markets.
You can make this drug for the cost of a cup of coffee, and it's selling for $1,000. So something's broken in the market where that doesn't seem to be priced fairly, and where the U.S. is paying a price that's 5 to 10 times what it costs in Europe.
Novo Nordisk's response? We appreciate that it's frustrating that each country has its own healthcare system, but making isolated and limited comparisons ignores this fundamental fact. But for Williams,
I feel disappointed. I feel like simply because we're the USA, they feel like they can charge us more, and that's just simply unfair.
In response to Senator Sanders' comment about Novo Nordisk being greedy, the company told us it's proud of the work its scientists have done to advance innovation and improve people's lives. It also said that even when it lowers its prices, too often patients in the United States don't get the savings. It says insurers and pharmacy benefit managers, along others, play a role in pricing too, and they make money in the system as well. Adriana?
Anna, thank you so much.